Without further ado, I'd like to introduce Web and Gabby to the stage. So, John, thank you very much for the intro. You covered all the great stuff, or some of the great stuff about Gabby. You know, again, Olympic gold medal winner. I think you might not have mentioned that you're expecting to represent the United States in the 28 Olympics in LA.
That's right.
But again, you know, just as importantly, you're I think a knowledgeable and committed healthcare advocate. You know, great educational background for that. Your service at the Austin Volunteer Clinic is terrific. You're an Austinite.
Yes.
This is your home territory.
Yes.
I think you might even be an HEB shopper.
I just might be, yes.
And I've gotten my Track Like Gabby tattoo.
I love it.
So I recommend that everybody get that. So anyway, thanks for joining us this morning. It's a good day for a run, right?
Oh, yeah.
So, you know, here we are at the beginning of a new year, you know, January 10th. It's a time where, you know, people make New Year's resolutions and frequently they include some health goals. So how does that look for you?
Well, one thing, I love New Year's resolutions. I know there's sometimes we see New Year's resolutions as something that you follow for, you know, the first few weeks of the year, and then it kind of drops off and you do it all again the next year. But for me, how I kind of combat that is I pick resolutions that I genuinely feel like I can follow, like things that are sustainable. And I just meet myself where I'm at. So if I have a goal, which for me typically does tend to be around health, given my career. So let's take this year, for example. I really want to pay attention to my diet. So I meet myself where I'm at. If my goal is to have a healthy, balanced diet so that I can train at my best, it doesn't mean that I can never have a slice of cake. It doesn't mean that I can never have pizza, which is my favorite food. It just means that I make sure that I am getting all the nutrients that I need to have, and then I can also have pizza or a slice of cake. And that's how I meet myself where I'm at. So my health goals are just sustainable. They're just me. Like, I make sure that it's something that I can do.
Yeah, well, that's comforting, because I know, you know, a lot of people would say, well, you know, that's Gabby, but she's an Olympian, and, you know, how does that apply to my life? So what would you say, you know, what are 3 things that, you know, anybody can do to take control of their health?
Okay, so 3 things I think anyone can do. The first one, which I love, is essentially just routine checkups. So that can mean, for me, that means, you know, I check my sleep very often. I started tracking my sleep since I was 18 years old with, you know, wearable devices, journaling, whatever it is. But I was always tracking my sleep because it was an easy thing that I could do, and I was really interested in it. Another thing that I check in is diet. I journal about my nutrition. I like to keep track of what I'm eating and the habits that I'm building, or when have I fallen off. So I journal that. And then blood testing it's another good example of routine checking in. And I am actually such a nerd about the blood testing, and I actually always have been. There is just something really fun about seeing what your baseline is and just going and seeing what's normal for you. When are you deviating from that? You know, when do you look really good? When are you slacking a little bit? And so I really love that. So I think routine check-ins can be fun at the end of the day. Another thing I would say is consistency. If you can incorporate consistency in your life, I mean, that's also the name of the game. Like I mentioned before, you don't have to have these really big goals or big ideas, but if you can have these small wins every day or small habits every day that you can do consistently over time, that stacks up, and it does make a big difference. So for example, for me, consistency looks like, if my goal is to win a track race that I have coming up, I don't focus on winning the track race. I focus on, am I hydrated today? Did I get all my nutrients in today? Those kind of small things that I actually can do consistently. And then the third one that I incorporate into my life that I think everyone should is peace of mind. Just making sure that whatever you are committing to, you feel at peace with it. Your mental health is also very important. And that goes back to kind of meeting yourself where you are. When you have these health goals, if you have any goal, it's just meeting yourself where you are first and then growing from there. So those three: routine check-ins, consistency, and just peace.
Yeah, well, that's fantastic advice. And I think you've said that health comes first in your life, or it's one of the first things. So how has that affected your decisions both on and off the track?
Yeah, I mean, health it's always been important for me, even before I was a professional athlete. But now that I am a professional athlete, it's almost everything. When you think about my sport, it's twofold, right? Part of it is physical health and part of it is mental health. The physical health aspect is half of the game. Track and field is essentially a measurement of your fitness, which is directly correlated to your physical health. So that's really what I'm focusing on, like day after day. I typically do use a lot of blood testing in my day-to-day, which is why this partnership is really so special to me too. I have a baseline. I do a baseline test every year at the beginning of the season before I even get into training, just so I know what is normal for me before I start getting into the stress of training, physically and mentally. And some of those markers for me is vitamin D is a really important one. I tend to be deficient in vitamin D, and honestly, that's okay. I know what my baseline is, and I know what I need to work on, and I know when it deviates from that. One thing I also love to measure is my cortisol levels. That's something that people don't think about very often, but especially for an elite athlete, that can change a lot throughout your season depending on where you are, for a variety of factors. So it's something that I like to just look at and keep tabs on. And of course, with all the other routine panels that we do, just making sure everything's good. Some things I really like to nerd out about are like the red blood cell count and hematocrit, that those are just things that I just get really interested in. But ultimately, yeah, it's about making sure that I am optimizing my health to the best way that I can. And the way I see it is, I don't have to get 8 hours of sleep every night, right? But I choose to do that because it makes me feel better. And I don't have to eat very healthy every day, but I do it because I want my body to feel good and I want to perform and have a good practice. And I also, I don't have to go get blood testing done, but I just want to optimize my own overall health and longevity in my sport. So these are just, I see it as optional, but things that I get to do and opportunities that I have to feel my best and be the best version of myself and be the best athlete version of myself. And then there's also the mental health piece of it. And the mental health piece is very important too. When I feel in control of my health, I feel more confident. When I feel like I have the power and the understanding of my own body and my own health, I feel like I can take on the world. I feel like a really great athlete. And I feel like I put myself in a really, really good position. And it's just making it fun. Like, make it fun for myself. And when it's accessible, like BetterWay, the more accessible it is, the more often I do it, the easier it is to do it. If I can come to HEB where, I'm coming already and just go get it done and then go look on my phone and have it easy to understand, it's fun. So that also helps with the mental health piece. It's just feeling like I have control over it, feeling like I understand what's going on, and just feeling empowered in that.
Yeah, no, like that's again, all terrific advice. And you mentioned some of the tests that are important to you. You're obviously a very healthy person. You're an elite athlete, but you also ran the hypertension clinic at the Austin Volunteer Clinic. So for people who are not necessarily healthy, what kinds of tests did you focus on there? Or what are some of the advice that you might give?
So at the clinic, we essentially, if you come in, we tested everything, right? So we did the routine panels, lipid panel, CMP, CBC, and then we also tested their blood sugar and their cholesterol, and their blood pressure. And when we saw some, markers and results from those tests and they were slightly elevated, we would put them into our hypertension intervention program, which is basically for people who we flagged as, pre-diabetic or diabetic, or just high blood pressure. And what this clinic did was or what this program that I ran did was we followed up with these patients, and just ultimately it was about making their lives easier. It was about making them feel empowered and control over their health. So we focused on those 3 markers, which was the blood sugar, the cholesterol, and their blood pressure. And we sent them home with blood pressure monitors when we could, just so that they had access at home. And I developed a relationship with them where I could check in with them periodically and often so that they felt comfortable coming into the clinic or asking questions or understanding their numbers or what they needed to do. Sometimes it meant house visits too. If we had to go to their house and just encourage them or drive them or bring them to the clinic, or to Seton to go get some lab tests done, then that's what we did. But it was really just about making it more accessible. And I mean, that was the name of the game. Everyone at the end of the day wants to be healthy, right? If you walk to any patient and speak to them, they don't want to have any like poor measurements or poor lab test results. Nobody wants that. But life gets in the way. People are busy. And when you're under-resourced, it's even harder to actually take control of your health. But when you have people who care about you and help you feel like, you have control over your health, that makes a world of a difference. So the entire objective of our program was just to make it easier and make it more accessible. And we saw a big difference. I mean, we tracked their results. We talk to the patients. We make sure that they're on their medication if they need to be, or we make it so that they're coming to learn about nutrition, because we also have a nutrition program. We have a chronic disease management program that they can come learn about how to manage their diseases too. And also for me, with my background in sports, we would encourage fitness, and we would bring shoes, and we would encourage them to go on walks or see how they can fit it into their schedule. So all of these small things that make a big difference. And at the end of the day, it really can be so simple. Right. It really can be. And we make it so complicated. We make it so intimidating. But taking control of your health is something that everybody can do. Everybody wants to do. And it's about simplifying that.
Yeah. So you mentioned access, which is obviously, I think we've all seen that, people delay care because, care is either, not convenient, or it's not comfortable, or they don't feel supported. So how important is it to be able to offer or get blood testing at a convenient location like an H-E-B pharmacy?
It's everything. And like I was saying with our patients at the clinic, that was the number one setback. And it's like we can contact the patients and we can talk to them and they know what the problem is, but the access is the most important part. And if you can just walk into a location that you were already going to be at, like H-E-B, everyone loves H-E-B, right? I mean, it's the best grocery store in Texas, and come here and just get the blood test done. It makes a world of a difference. I mean, it really does. And like I said, it can be so simple if we just allow it to be. And I think the most important thing is if you feel like you have control over your own healthcare, that's what matters.
Yeah. And so just sort of adding to that, the backstory is, 70% of medical decisions are based on blood testing. The research says that about 30% of people are non-adherent to testing, either because of inconvenient locations or needle phobia, or some combination of both. And so, how important is it to marry the convenience of H-E-B with the patient friendliness of a fingertip blood testing process like BetterWay?
I mean, that was our biggest challenge with retaining the patients in the program. They'll text us back, they'll call us, but getting them to actually go take the test themselves and get the results for us, that was kind of the biggest bottleneck issue, because it does take time, it's inconvenient, and it's scary. So I think this would make a world of a difference, even for someone like myself. Sometimes I'll put off getting blood tested. I'll look up and it'll be a couple of months later, and I'm like, well, missed the window, missed the window in this training cycle. I guess I'll do it the next one. And it happens, and it's my job to track my health, and it happens to me. So I can't imagine how it can be inconvenient for people who it's not actually your job and you have to make the extra time for it. So yeah, this would make a world of a difference.
So are you a little needle phobic?
I am. Weirdly enough, I feel like the more that I get the IV needle prodding, the more squirmish I get about it. And I don't know what it is about it, but it just, ugh. So the finger pricking is a lot less intimidating for me, and obviously a lot less invasive.
Yeah. I mean, it's interesting that the research is that 30% of people are non-adherent to testing, partially because of needle phobia. But then the research also says that 80% of people feel some level of anxiety about having somebody stick a needle in their arm.
Yes,
And,
exactly.
I feel that way myself. It's not necessarily that I wouldn't do it, but I surely don't look forward to it.
Exactly. And I look forward to having my results, but that part of the process does give me anxiety. But what's really exciting about, I think, the BetterWay lab tests is it's a quick and easy finger prick, but also just having the results on your phone very shortly after and having it laid out in a way that you understand. Yeah. It's really fun to go through and look at. And you understand yourself and your body a lot more, and it's written in plain English.
Right. Because I think a lot of people, I went to the doctor recently and I got my results, but, and I've been in the healthcare business for a long time. I really didn't understand what they meant.
Right.
And so it was pretty unsatisfying to have to go through all that brain damage and then, I guess I'm okay.
Yeah. I guess you made it. You're here.
Yeah. So, among other things here, what we're doing is this is the launch of the Track Like Gabby, program. And so, as I said, I've got my Track Like Gabby tattoo. So what does that mean? What does the program mean to you in a couple of sentences?
Track Like Gabby means to me feeling empowered to take control over your own health. And it means being intentional about it. But you don't have to be an Olympian to track your health like one, because of programs like this. It just means being intentional and taking control over your own health.
So when you sort of look at the future of healthcare, how important do you think it is that people, have easy access to patient-friendly blood testing?
This is the future of healthcare. In my opinion, this is it. It's people, it's patients and individuals having power over their own health. They decide when and where they want to go get their checkups. They have access to their results. They understand their results. They know their own body and they know what's going on. And it's easy. It should be easy. You should have access to your own body and health information at your fingertips. No pun intended. But the fact that we have these results and you can understand it right on your smartphone, right after getting the testing, that's the future of healthcare. It's people being informed and having their own agency over their body, over their health.
So, just to finish off here, what would you recommend that people do who are concerned about taking control of their health? What are the priority things that you would hope that they would do this year?
One, I would say get excited about it. Just get excited. This is very exciting stuff. I think the future of healthcare it really is it's tremendous. Get excited about getting your routine checkups. Get excited about having access and having that power and having that knowledge, because it really is right here at your fingertips. And then I would say, figure out how to meet yourself where you're at. If you think that you can do it once a year, twice a year, and that's it, just focus on that. And then you can grow from there if you need to. But just make it kind of these bite-sized, chunk-size goals that you can do, that you can accomplish in your day-to-day life, and meet yourself there. And then just keep growing. That's how I tackled my career. That's how I tackle tracking my health. And just go from there.
One step at a time.
One step at a time. Exactly.
All right. Well, thank you, Gabby, so much for spending time with us.
Thank you.
This is terrific. And good luck in your training.
Thank you. Thanks for having me. Thank you, guys.